Welcome back to our channel. Today, we'll be diving into aortic stenosis, a common heart condition that affects many individuals worldwide. Aortic stenosis refers to a narrowing of the aortic valve, which separates the left ventricle from the aorta. It obstructs the blood flow from the heart to the rest of the body. The most common cause of aortic stenosis is degenerative calcification of the valve, typically seen in elderly individuals. This occurs due to wear and tear over time, leading to calcium deposits on the valve leaflets. Other causes include congenital heart defects, rheumatic fever, and a rare genetic condition called bicuspid aortic valve. Now that we know the causes, let's delve into the pathophysiology of aortic stenosis. As the aortic valve narrows, it restricts the blood flow from the left ventricle into the aorta. The heart compensates for this obstruction by increasing the pressure gradient across the valve. Resulting in the left ventricle working harder to pump blood out. Over time, this increased workload can lead to left ventricular hypertrophy and eventually heart failure. Now, let's talk about heart sounds associated with aortic stenosis. The classic heart sound in aortic stenosis is called a systolic ejection murmur. This murmur is typically heard during systole, between the first and second heart sounds. It often presents as a harsh, crescendo-decrescendo murmur that radiates to the carotid arteries. In severe cases, the murmur may be accompanied by a thrill, which is a palpable vibration over the chest. Lastly, let's discuss the management options for aortic stenosis. Treatment for aortic stenosis depends on the severity of the condition. For mild cases, regular monitoring and lifestyle modifications may be sufficient. However, for moderate to severe cases, surgical intervention is often required. The most common surgical procedure is aortic valve replacement, where the diseased valve is replaced with a prosthetic valve. Transcatheter aortic valve replacement is a less invasive alternative for high-risk or inoperable patients.